this is Tobie, and Tobie's 11 years old, and, whoops, a good boy. Tobie, as you can see, is a bit overweight. Tobie has arthritis. He's old. I mean, he's 11. Well, middle-aged. Sorry, Tobie. But he has arthritis because he was declawed when he was about, maybe 6 months old, which totally changes the structure of the paw. He doesn't have the full toes. When you declaw a cat, you're actually taking the entire first part of the digit, maybe about that much of your own hand or paw. So it's a lot of weight for him to be putting on these little feet that are not really good at supporting him. And he would probably not show you how he walks, but he's much better now that he's on the glucosamine.
Just like with the dog patients, the animal's been checked out thoroughly by the vet, and I only work in the veterinary hospitals. I am considered by the State of California Board of Chiropractic as an unlicensed vet tech when I'm doing this. I am a licensed chiropractor, and I've gone through extensive training with an ABCA approved course and take 30 hours and continuing it every year to keep my certifications. I would take his little head and do range of motion. Looks pretty good, Tobie. You may have a lot of weight on him, but your neck's doing it. And they like this. His eyes are they're closing right now because it just feels just like it is with us. It just feels good. And I try to get the legs even, and then I palpate on him. It's going to be a little harder. Well, I actually did find his little, what we call tuber sacralis, and they are level, so that means his pelvis is lined up. I'm looking at that, and his sacrum feels good. Then I just kind of go down his spine and see if he twitches at all. He doesn't seem to be twitching much. The other thing, I'm also feeling for any heat, because that can indicate some inflammation. Might be going on in any warm areas of the spine. He's a very sweet cat.
Tobie's looking at the skeleton.
Usually the cats aren't this good. They're usually, flopping down, and he's liking this. He's looking at that skeleton and goes, that's what happens when you lose too much weight.
That's right.
Take his little leg and just...
Yeah, like I said, Tobie, I don't think really has arthritis other than those paws. Yeah.
He is carrying a little bit of weight. I'm also going to check the shoulder blades, the scapula, to see if they're lined up, and they're pretty equidistant. Sometimes you'll see the scapula on one side will drop down a little bit, and then I can just I use the activator to adjust. Let's say his little shoulder blade here on the right was moving to the side laterally, what we call it. I would just take the activator and set it at a real low setting and just adjust it like this. Now in a kitty, this is a little bit bigger than the dog, but it works just as well. It's putting a force into the bone, a gentle, high-velocity force, and it puts the bone back to where the bone should be.
Arthritis in one area is going to affect
absolutely.
the
See,
rest
the
of his
biomechanics of his front feet aren't. It's just not normal. So he's got a problem down here in his little feet, so it is going to travel up. Just like if you sprain your ankle and you start favoring that side and you put the weight on the other limb, you'll start noticing that your other knee hurts, the hip hurts. Same with these guys.
He's a star! Tobie! It's your...
He's a star.